Welcome everyone. This is our weekly residents meeting here in the clinic, and today we have our chief resident again, Kylene, and she has some questions for me. I don't know what they are. She tries to surprise me, so we'll see what happens. But what we do is we rehash or go over cases that we've had during the week that we've treated successfully or perhaps unsuccessfully to try to help you clinically in your practice. Okay, so I'll turn it over to Kylene.
Okay.
Speak loud.
So this week, our case, we had an interesting patient come in with the disorder called Stargardt syndrome, and it's a severe form of macular degeneration in the eye. It's a genetic condition, and when I encountered her in the room, my experience at that point with eye diseases, I had told her that my treatment approach would be something more of cautious, something that would go a bit more slowly. And then I came to you to ask you, in your experience with macular degeneration or issues with the eye, what your prognosis and then also your treatment strategy would be. Okay.
I've treated macular problems a lot over the years, and with mixed results. I would say the success rate's around 50 to 60% to get the eye to function better. The best case I ever had was a woman in her 80s, and she had, typical, in her case it was dry macular degeneration, and she could see, she had a vision of she had a 2300 in one eye and 2100 in the other eye, and she couldn't see me. She asked me what I looked like, and I said Tom Cruise. I don't know whether she believed me or not, but anyway, she didn't laugh. So in the course of treating her, one day she said, "You don't look like Tom Cruise." So I knew she was getting better. The 2300 went to 2100, and the 2100 went to 2030, and she passed her driver's test. And the improvement was so dramatic that the ophthalmologist tried to backtrack and to say that she didn't have macular degeneration, which I thought was really mean to say such a thing, because of course she'd been that way for years. Because the MDs have told everyone it's an incurable disease, not many people will come to you, actually, is my experience. They just give up. But it is treatable, and I failed in some cases, but I think of the ones that I failed with, they just didn't complete their treatment plan. So here's my approach. I need to see them for 4 to 6 months, and I will re-examine them in 1 month, which means send them for an ocular exam. If there's some improvement in their eyesight, I will continue. If there's none, then I will stop. And how do I treat? Acupuncture works very well for these eye diseases. And the question comes down to what's the correct image? Well, there's lots.